Early lessons from COVID-19 have already and will continue to enable us to prepare for the next pandemic, while also, I certainly hope, transforming global health systems in the process.
The need for collaboration and public-private collaboration has never been more important, and that's not something that we can only organize with events.
This group that's been thinking about pandemics long before this pandemic, and really thinking about the high-level pandemic simulation we had that Bill Gates chaired in Davos in 2017, highlighting those challenges of pandemic response where public-private cooperation is essential, and really showing the gaps that remained. And we worked together as a group since then.
Innovation's really been part of our culture, and we needed it desperately as the pandemic came to New Jersey. And 30% of our visits in our ambulatory centers are still using telehealth. And I think that's here to stay, and it was great innovation. In addition, we took some of that digital strategy and we moved it into the home, but literally doing home monitoring for chronic conditions and seeing our patients, both COVID and not, keeping people with chronic conditions that didn't have COVID out of the hospital was really, really important. And we also used the telehealth platform in our nursing homes so that they could be monitored at the night by our hospitalist program.
You know, we've been very proud to see how adoption of next generation sequencing across the globe has unveiled SARS-CoV-2 and provided the virus genome, the evolutionary rate, and insights required for diagnostics, public health surveillance, and treatments faster than any prior epidemic or pandemic.
Looking at how the world's been knocked sideways by this, where what began as a health challenge has become a full-blown economic and social crisis. There has been a failure of global leadership in the broader sense. WHO has batted on, but its brief is pretty narrow. You need the geopolitical and geoeconomic organizations stepping up now to stop the worst happening from a runaway pandemic, and the mobilization of support for that in a very polarized world hasn't been forthcoming.
In this unprecedented crisis, nothing less than unprecedented cooperation would be sufficient to address those challenges and to protect lives and livelihoods. And that was the thinking behind the COVID action platform that we have here at the forum now, and with many of you, where we have over 1,500 partners and now 42 projects on workforce and manufacturing and vaccines and data and social sector and so on. We know that we can't afford to have the same tolerance for this kind of oscillation between panic and neglect, and it's really going to be, that we had before, and it's really going to be up to this community to make sure that that doesn't happen.
This isn't going to be the last time that the world's faced with a zoonotic disease. In the last 17 years, there's been 6 public health emergencies of international concern. 6 of these in 17 years tells us we'd better be a damn sight better prepared. And the world has changed enormously in its connectivity since 2003. When a disease comes out of a country that's now, sort of fully globalized, its citizens are on the move, it changes everything.